Hi, I'm Deidre Thompson.
And I'm John Harvey.
And I'm Morgan Baxter. And for our community assignment, we decided to interview Dr. Laura Case in order to get an additional perspective on Duchenne muscular dystrophy that we didn't get in class. Dr. Laura Case is a practicing physical therapist as well as an associate professor at Duke University in the Doctor of Physical Therapy program. Dr. Case, besides being a practicing physical therapist, she also has a pediatric clinical specialty and a certification in neurodevelopmental treatment. She treats patients with DMD as well as done research in the field of DMD. She has done research on creating standards of care for DMD as well as a transition toolkit to help those who are transitioning from childhood to adulthood with DMD.
The main message that we want to get across to our viewers is that physical therapists play a very important role in the lives of DMD patients, and including helping them thrive. And this interview also highlights some of the challenges that are associated with coming of age with diseases such as DMD.
Dr. Case provides her unique perspective on how a physical therapist has to approach working with children that have DMD. And she also shares how her duties go beyond treatment plans, as she speaks about validating patient frustrations, advocating to improve their standard of care, and preparing them to transition into a more independent adult life.
There wasn't as much perspective probably, or at least it seemed like it to me. This time there wasn't as much sort of philosophically. You can look at something in which the natural history of something is progressive, and that can, as a healthcare provider, that you have to come to terms with how you're going to, how you can best help somebody and how you can help them, you can help them with a better quality of life and all kinds of things, even though the natural history of that particular diagnosis may be progressive. And so that's a different mindset than, or it can be, than a lot of other areas of PT where you're helping kids learn how to walk and learn how to sit up, and which I love all of that. I love all of that. But I also love being able to help somebody maintain a high quality of life, even if they have something that's progressive. So that to me is just as exciting as helping somebody learn how to walk for the first time. So.
And then when you are working with patients with DMD, you said it's, the difference because it is a progressive disease. So there's kind of a different mindset working with those patients. How do you feel like going into appointments with DMD patients? And then how do you think that they feel after you get to work with them? Like, are they excited for their appointments, or like, how does that?
Well, right now it's an incredibly exciting time because there are disease modifying treatments that are actually out here. So I've worked for decades with children with Duchenne and young men with Duchenne when there were not actual, treatments that were disease modifying. So everything we were doing was to still shoot for quality of life, use all your PT measures, prevent contracture and deformity, help people maintain function, make sure they can keep up with their friends, make sure they can thrive in their lives. That's the bottom line. You want the people that you work with as a physical therapist. I love seeing kids thrive, and you want to get everything out of the way so they can get on with their lives. And so that's what I love doing. And you can do that with whether somebody has a diagnosis that is, not progressive or is progressive. You can still try to help them thrive. And so I think that you have to, one difference for physical therapists is you have to measure whether or not you are being successful in a slightly different way sometimes. So it's easy to be able to gauge whether or not you're doing a good job or being successful, which is of course something we all want to do, is do a good job for the kids we work with, the patients we work with. If you always feel like you have to measure that by helping somebody make gains and forward progress and get stronger or get run faster or something like that, then you're gonna feel like you're failing if you work with somebody whose the natural history is progressive. But if your measure is against what the natural history would be, and how you are changing that, and how you are helping maintain a high quality of life and letting somebody thrive in spite of that, then you know whether or not you're being successful with that person. Are you helping them the best you can be able to thrive in their life, to do the things that they want to do, to keep up with their peers, to shoot for the stars in their life. And so if those are your measures of success when you're working with somebody, it's important to keep that as the focus, I think. And I do think that as physical therapists or as physical therapy students, you have to, I think it's important to stop and sort of get your head around that and get your heart around that, and sort of wrestle with that a little bit, because you are going to grieve when people do lose ground or have a harder time. And so you have to find a way to grapple with that, your own self too. So it's kind of complicated.
Yeah, no, absolutely. There's definitely like many elements that are coming together.
Right. And so the other part of your question was whether how the kids feel coming into PT.
Mm-hmm.
And so that's one of the things I love about PT, is that this isn't exactly our job in some way, but we have the opportunity to help kids feel great about themselves, right? Mm-hmm. So, they come in. So first of all, when a child walks into the PT department, so, my opening line is usually, well, what kind of toys do you like to play with? And they're like, oh, I'm coming to this place to play. Like, they may not have thought that. They might have thought, oh, I'm coming for whatever reason. I have to do something, or they're going to make me do something, or whatever. And so even if your opening line is I wonder what we should play with today, then they feel like they're coming into an environment where they're anticipating having fun and feeling good about things. So I think that's fun to do. And to remember that it's their therapy session, right? And if it's going to be part of their lives for their lives, because they may need that to keep in the best shape possible, then it needs to be pleasurable for them. And so, nobody likes to work out in a way that they don't like to work out, or everybody likes to do things that they enjoy to stay healthy. And so I think it's really important for the child to have fun in therapy. If a child's not having fun in therapy, it's my fault. So you shouldn't expect the child to come in and have their own agenda that they want to work hard. Now, after a certain age, they do,
Mm-hmm.
and they have their own focus on things that they want to work on. But especially when they're young, I think the important part is to make sure that they feel good in their world, in the world that you're offering them to come in and enter. That's a place where they can feel great about themselves. So I have several rules. They're always smarter than I am. They're always funnier than I am, the kids. They're always faster than I am. They win every game. Now, don't tell them this. So you probably can't post this anywhere, but I'm teasing. So the bottom line for their experience in a PT session should be that they leave feeling great about themselves. And it's really easy to do that. You can give a child a challenge and have them succeed at that challenge, and they're going to leave feeling great about themselves, as well as having done whatever PT things that they needed, to get accomplished. So.
Yeah, no, that's really cool to think about, like empowering kids while you're working with them.
Yes, and I actually love to use anatomical terms. So I talk about which muscles we're stretching or doing or whatever we're doing, because then just think of some, like a little, 6-year-old or 7-year-old, and they will know their anatomical terms. So, I'm stretching out my IT band, right? So then they go to say an appointment with a physician, and they've got all the medical terminology they can talk about, and it does give them power.
Uh-huh.
Knowledge is power. So that's another really fun part, I think.
That is cool. Yeah, no, that's cute. And then you mentioned that the field of DMD has just changed a lot because now there are a lot of different treatments. I mean, no cure or anything, but a lot of things that can help with the progression of the disease. Can you talk a little bit more about how that's changed and how you've seen the field change?
Yeah, well, the first thing that was disease modifying didn't change the genetic components of anything, but it was steroids. Mm-hmm. And so that helped children maintain their strength. So that was the first thing that would be considered disease modifying, not in terms of changing the genetics of what was going on, but in terms of sort of medically changing things. But now, I mean, there are gene therapy trials going on. There are all kinds of things going on that someday, I mean, I believe that someday, yeah, it's a really exciting time. I shouldn't say too much, but yeah, but there are things that are actually changing the actual disease process. And so it's really exciting. So that changes things for us as PTs in that, you know, we've always tried to maintain a high quality of life and do everything we can to minimize the clinical impact of the pathology of the disorder, right? So we've always tried to do that. But now, for the first time, with disease-modifying treatments that come out, I mean, it opens the door to someday helping somebody actually gain strength and regain function. And the young kids, I just feel really optimistic about the young kids, you know. So you meet someone that has just been diagnosed at a young age, maybe 4 years old or younger, and they've just been diagnosed. And, you know, it's always been this dual thing where you immediately bring to the table all the things you know that can help, you know, and so you educate the family and you hopefully introduce the child to therapy in a way that they have fun. And so there are all these things you're doing to try to help, but at the same time, you know, your heart is breaking that, you know, this child is gonna have to deal with this. But now I feel like the future for those young kids is gonna be really different over time, even much better. So yeah, it's a really exciting time.
That is exciting. Yeah.
Working with DMD patients, what's it like having to collaborate with so many different like specialties?
Oh, that's a great question because there are so many. It's a multidisciplinary. Yeah, to do a really good job, you need a multidisciplinary team. Well, I think that's great because I can bring to the table what I know, and then everybody else is bringing to the table what they know, and the parents are bringing their expertise because nobody knows that child like the parents or the caregivers in the family. Nobody knows, so they have their expertise, and then the child knows what their area of expertise is, which is what makes them happy and what they want to do, right? So I think it's really fun to have and very important to have a multidisciplinary team to work with. Yeah, everyone has a piece of the puzzle that when you put it all together, it's going to be way more successful than any one of us working alone.
So we've all kind of did some reading about like casting, orthoses, and like different standing devices as like assistive technology.
Mm-hmm.
And I kind of just wanted to ask like how these forms of assistive technology have an impact on the patient.
That's a great question. Well, they can be really freeing. And so it can be a mixed thing in that you can look at the need for assistive technology as something that is an indication of the fact that somebody's having a little more trouble or something, right? But we all use technology. And so to me, it seems like it only makes sense to, if there's technology that will help you be freer in your life, then that's what we all use, right? So I actually love to talk to the kids about saying, well, you're a techie, right? And they're like, yeah, you know? And so you're not telling them, oh, you know, this is hard for you, so we're going to get you this device. You tell them the truth, which is probably you know, if you're having a hard time with technology, you're going to call a 12-year-old, right? Because they're going to be better at it. This is true everywhere, right? So you tell the children honestly that they're really good at technology. They've grown up with technology, right? And so look at this cool thing that's going to make it easier for you to do this or to go faster.
I just wanted to know, like, what are some of the things you would tell people with DMD as they're getting ready to transition into adult living?
In adult, well, I think you start when they're young, actually, and again, it has to do with empowering them. So I like to try to give children the message, which I believe is true, that they are, I mean, they're in charge of their lives for one thing, and they're in charge of what they want. And so they have decisions they can make about what they want to do, just like any child, you know, what do you want to do when you grow up, you know? And so we want them to be free to be dreaming about what they want to do also. And so we want to keep doors open for them in their imagination for what they could imagine themselves being someday. So you start that when kids are very young. And you also, I think it's also important to define things for them. You know, you always are defining things for children as they're growing up. And so if a child is needing to ask for help for something, supposing they are having a hard time getting up from the floor and so they need to ask someone to give them a hand or something like that, or if they have a hard time with their shoe or something, and they need to ask for help. So I like to define for them that they are getting really good at delegating. And so, because that's what asking for help is, it's a form of delegation, right? So you're delegating to somebody else to do something that you would like to have done or need to have done. And so you're delegating. So I always tell them that I think that they are learning. I like to compliment them and emphasize to them, look at what incredible delegation skills you have. I want to know what you're going to do when you grow up, because you could be the CEO of some large corporation, because you're going to learn how to delegate way better than a lot of your friends are. And so that's a different message to give to a child about when they're having to, ask somebody. So they shouldn't have to be apologetic about asking for help when they need help. They're just delegating like everybody does. If you have too many things in front of you that you can do all by yourself, then you delegate some, right? And so I think to frame it that way, you begin really young, building their good feeling about how they're managing their life. And so then as they transition to adulthood, it's the same thing. They're going to be hiring, they might be hiring a personal assistant to do something for them. Well, big important people in the world hire all kinds of assistants, right? And so I like to, make them, make it clear that they're hiring somebody. And so that's a really important grown-up skill to have, to be able to know who to hire that's going to do the job the way that you need to be it done. And what do you do if somebody's not working out? How do you handle that? And so I think you're building those skills, hopefully from a fairly young age, and so that they get comfortable with that. And again, it's all about self-esteem and all about feeling in control of their lives. Hopefully that they will have an expectation of access to the world. So they have the right to expect the world to be accessible for them, just like you would like for all children. I was going to back up and say, in terms of what we were just talking about a minute ago, I also think it's important to validate if children are frustrated. So of course, I'm always, wanting for them to not be frustrated and for them to be able to thrive and do what they want. But I think it's also important when they are frustrated to also give adequate words to that, so that they realize that they have a right to feel that way. And for children that have Duchenne, I think it's really important for them to know that it's their muscles, right? It's not them. So, I learned this from, most of what I have known, I've learned from children. And so I learned from children many years ago that they can have this perception that, say, if they're falling, they're having a hard time keeping up with their friends, they're falling, that they're failing, right? Well, it's not a personal thing. It's just their muscles are having a hard time. And I think that that's a message that young kids can understand. Oh yeah, it's my muscles, and that separates it out from that they as a person aren't succeeding. That's not true at all. It's just that their muscles are having a hard time. And so I think to give them language that helps them process that and separate that out, I think is important.
Could you talk about the financial burden of having a disease such as DMD that is so progressive and lifelong?
So I think the other thing that is really important for us to advocate for is to get adequate, as much funding support as you can for the children and their families, because a lot of the things that are needed are expensive. So the equipment is expensive. And so it's important to support the family. So, so to know the different, so, you have private insurance, you can have Medicaid, if you earn too much money to get on Medicaid, there are Medicaid waiver programs. There are, when kids turn 16, well, depending on the state, you can have independent living and voc rehab. So it's really important for us to know what are all the different funding sources that you can turn to assist the family. Because otherwise it is, the stuff that's needed is expensive. And so we need to take that on as well and help the best we can. I'm not sure if that answered your question. Yeah.
Oh yeah, definitely. Because in lecture, we never really talk about exactly what kind of financial distress the families might be going through, because we recognize that the children have to have constant like intervention, and that must be like really expensive. And so we didn't really know how much like insurance would really cover, and how much like the families had to pay out of pocket and stuff.
Well, I think it's really important for us to advocate, as I said, for that, because it can be, so supposing you, so like the stand and drive wheelchairs, right? You probably read about them if you read about standers and all that. So they're expensive, but they do really important things for children. And so as a physical therapist, if you recommend something that you think is good for somebody, so this is an important point, I think. So you're not going to only recommend something that you think that family can afford, right? You're going to make a recommendation for what you think is important for that child, and then you're going to fight for the funding with them. And you're going to have plan B and plan C. So if you don't win the funding, but then what else are you going to do to meet that child's needs? So, so it takes a lot of work actually to do that, because you have to write letters. So you could write a letter for why this stand and drive wheelchair is really important for this child, and the funding agency may come back and say, no, we don't think that's important. And so then you have to appeal it. And so there are rules for that. So it's important to know the rules. So the rules are, if a funding source denies something, they have to tell you why they've denied it, and they have to tell you what the process is to appeal it. And then you work with the family, do they want to take the time to appeal it? And then you need to help. I mean, I think you need to help them appeal it if they want to, and if it seems important. So it can be a little labor intensive in terms of the healthcare professionals to really advocate. But if you successfully advocate, then that's how the standard of care gets changed. So if then you can successfully advocate for enough children, and then you can see that those things are helpful to them, then it becomes less questioned. It becomes the standard of care, and then it's easier to get the funding for things.
As a physical therapist, what kind of activities can DMD patients, like what are they restricted to? Because I know that you want to prevent muscle damage as much as possible. So how would you do that? Are there like restrictions for those patients?
So there's a certain amount that you're doing by paying attention and by watching their fatigue levels. I mean, even in the old literature, they used to say, if you're sort of wiped out the next day, you did too much the day before, which is so generic, it's such a general rule of thumb, but it sort of makes sense for anybody, right? And so, so the more gentle forms of exercise like swimming and cycling, as long as you're not doing a lot of resistive, you can make almost any type of exercise resistive or not. So even something like aquatics, which is a really gentle way to exercise, usually if you put a lot of resistive pieces of equipment on and had somebody work out too hard in the pool, that could actually be too much. But generally the pool is a great place, and cycling, again, as long as it's not uphill, or if you give somebody some assistance. So it's a judgment call. It's probably the hardest judgment call to make, because it's hard to know exactly. And so again, I think you try to, there are tools that most physical therapists use, like rate of perceived exertion and all kinds of other things that you use to try to gauge things in most populations when you're exercising. And so for children with Duchenne, that you don't want to overdo it. You don't want to, these are fragile muscles. So you want to be protecting the muscles by not overdoing it. And so I think to have the child on board, and again, to teach them to respect how their body is responding to exercise, is probably a good way to go.
To conclude, Dr. Case showed us the very important and personal relationship that exists between physical therapists and the DMD patients. This is a perspective that we weren't able to see during lecture.
And she also clearly demonstrated that being a physical therapist goes beyond just working with patients in the clinical setting. Advocating for patients and building their confidence are also two very key components.
We wanted to say thank you to our TAs and instructors of this course, but especially we wanted to say thank you to Dr. Case for taking the time for us to interview her as well as learn from her.